Namaste and welcome. I am Dr. Omkarnath Deshpande, and in this video series, we are trying to make scientific medical information about COVID-19 disease available to you in simple language. Thank you for watching our videos. This video is about disease symptoms and laboratory testing about COVID-19. In India, we follow guidelines that are given by the government, and the guidelines are changing as per the situation, so we should all be updated. These guidelines shall be changing in some time. First, understand that fever, cough and cold is a very common disease in India, and we all of us have cough and cold at least 3 to 4 times a year. Not every cough and cold or fever will be due to COVID-19. So do not panic, but take care. Not all persons having cough, cold and fever need to be tested. In fact, you cannot yourself go to any clinic and ask for a test. Let the doctors and the government decide what is best for you. What are the symptoms of COVID-19? As we've seen, most of the people would be asymptomatic or mostly would have mild symptoms. Cough, cold, mild fever, running nose, sometimes mild diarrhea, feeling of weakness and less energy. Remember that not all fever and cough is coronavirus. Do not panic. Very few people, that is 10%, are going to get severe symptoms. What are the emergency warning signs that you may have severe disease and you should get immediate medical attention? That is when you have trouble breathing, you have a feeling of pain or pressure in the chest while breathing, you have suddenly developed some mental confusion, or your relatives do not, or it is difficult to arise you from sleep, or your relatives notice that you've got bluish lips or a bluish face. So who should currently be tested for COVID-19? So all symptomatic individuals with international travel in the last 14 days, all symptomatic contacts of laboratory confirmed cases, all symptomatic healthcare workers, all hospital patients with severe acute respiratory illness, that is people who have fever and cough, cold and shortness of breath, asymptomatic direct and high risk contacts of a confirmed case. They should be tested once between day 5 and day 14. Understand, different states may have a little different guidelines, and these guidelines also would change, so please be updated, and we would also let you know guidelines as they appear. These are issued to us after discussion between the Indian Council of Medical Research, the reputed doctors in the country, medical scientists and top officials from the Ministry of Health and Government of India. So where is the testing done? Every state has got government labs and private labs in major cities. The list is being continuously updated and new laboratories are being added, and research is also ongoing for new kits, new detection methods, blood tests, etc. Research is going on. How is the test done? Right now, the gold standard that we do is the RT-PCR. Doctors will put in a small stick inside your nose or in your throat if the nose is not possible, and take a sample. Now on this sample, a test called as RT-PCR is done, and depending upon what type of kit is used and what method is used, you may get your result between 2 hours or 2 to 3 days. Test types are also under research. New tests are coming, new methods are coming, and they may change in the future. What if the test is negative? It means that you are more than 90% safe. 90%. Sometimes in few patients, the test can become positive after 4 to 5 days. So it is best that you keep quarantine for all 14 days if you think, and test again if the doctor is going to advise you. Remember that no test is 100% sure. No test can give you 100% yes or 100% no. Always it is better to be safe and follow the advice of the doctor. What if the test is positive? Don't panic. Mostly you are going to have a mild disease. You are going to recover 90%. Doctors will evaluate you, look for other diseases that you may have, evaluate what is your risk, and maybe they could do isolation treatment for you. Try to remain positive, take care to protect others, and strictly follow the guidelines that are given to you by the doctors. Do not try to use your so-called self-perceived influence by getting in touch with people who try to influence the treatment of doctors. Please do not do that. We are all under a process of research. We all are fighting it together. So please do not try to make things difficult for people who are working for your safety and for your benefit. In the next episode, we shall discuss about how to protect yourself, protect others from the chance of coronavirus COVID-19 infection, and some simple, practical and useful guidelines of protection. We hope that this episode was simple and it provided useful information to all of you. For more episodes, please keep watching and share this with your friends and relatives. Namaskar, thank you, and Jai Hind.